enhancing clinical documentation education, the topic area of education and research. As we are already aware, the healthcare informatics is able to collect, manage, and analyze the patient data, and adding AI improves the automation data entry, assisting in the diagnosis from provisional to final, and streamline the documentation. Education and research are the essentials for a proper implementation of AI in a healthcare systems. For effectively use of such AI tools, it has been observed that if a proper training is rendered, the diagnostic supports would be amazingly giving the outcomes which would lead towards a proper final diagnosis. Documentation would be automated. Predictive analysis would be easily predicted with the exact or plus or minus 1% of the prevalence. Automation in the administration would definitely lead towards decrease in the cash flow, which has been very high every month. Time spent on documentation would be decreased. Clinical satisfaction in terms of 60% of participation in terms of diagnosis. Yes, initial training and workflow adaptation were the major challenges, but it can be pulled up because now AI is in demand and it is limelight in the whole world. If we use a proper workforce, technology, and finance, the process would be just delivery, management, decision making, and training. And the output will be the efficacy, cost savings in terms of patients, in terms of the healthcare professional, in terms of the benefits for the hospitals. Just few loopholes would be identified at an individual hospital or at a particular area of hospital, which can be identified and it can be customized in this AI area. As we're already aware that the healthcare professional numbers are very less in each and every country. So AI would help the healthcare professionals to diagnose very quickly and save the times of each and every level. So the shortage of healthcare professional will be directly decreased here. So it will helpful in this overcoming this big problem, clinical burnout. Many healthcare professionals are not able to diagnose a new disease because of the less experience of the teaching and less current education. This would help in that. Documentation burden would be definitely decrease. Variable diagnostic from accuracy from provision to final would be definitely lead a big role because this would impact the help the healthcare professional to take a final decision. Long wait time for like 1 to 6 months will be directly decreasing as it saves the time at each and every level. So this all become possible by only one solution, that is AI. Sustainable AI adoption depends on the education and the organization support. Market demand of AI is like drastically decreased in just last 2 3 years. It is observed that US AI healthcare is projected for $187 billion by 2030, which is a big amount, big amount. Business impact, if we talk about, we can see the success rates as we adapt the AI, which is in the brown color line. If we just go with the traditional aspects, business would be growing, but at a particular same 5 or 10% hike. But if we implement AI, it would directly impact by 20 to 30%, which is easily observed over here. Clinical impact, office hours would definitely decrease. AI stethoscope detecting cardiac conditions, which is the best example. Practically nowadays, we're not implemented, but yes, slowly and suddenly it would be implemented. Diagnostic accuracy would be more precise because doctor might not remember all the words, all the symptoms which has been addressed by the patient, but the computer, the AI would definitely remember and remind the healthcare professional again and again. Enhanced clinical assessment, individual patient or the healthcare professionals or the reminders won't be able to be given by the manually, but here the automated system would definitely help a lot into it. And reduction in the medical errors. So at every stage it saves the time, reduces the error, it helps in proper diagnosis and decreases the office hours. So here I conducted two interviews where both the healthcare professional addressed that the AI documentations would definitely use a lot, and it would decrease at least 30 to 20 to 30% of the workload. Patient flow would be going very smoothly and it would be more satisfactory, and lower cost for the support staff would be there. And while in the setup of hospital, a doctor addressed that faster intake processing would be there, which would help the patients and the community of healthcare. Training training challenges would be there, but there is a strong ROI, so a small training can be given as a part of our regular training sessions, and would directly implement the whole channel properly in organized manner. Strengths of AI: efficiency and automation, cost savings for clinics, improve clinical decisions, and supports preventive medicines. There are many patients who just take the medicines by referring to multiple healthcare professionals, but here a proper record would be there. Because of that, a proper human healthcare would be taking up. Challenges: upfront cost of AI. Definitely, it would be sometimes been costing a lot from a primary healthcare center, but for a hospital, it is very small. Data privacy issues. A common healthcare center can be seen, identify data of patients being treated in other patient if permission is being given. So that is a concern as of now. Liability concerns would be definitely there, but training and adoptions burden would be also there. But all this is leading towards a huge amount of ROI. So these challenges can be easily be taken care of. So comparison, if we compare to the previous traditional approach, that would save a time, so it has to be implemented. Like market and social justice, if we compare, innovation is always should be taken up care and is always given a chance. So ethical need of this kind, such kinds of AI tools would be always appreciated. Economical implementations won't be impactful because there's a strong and specific ROI, which would definitely help each and every healthcare professional, starting from primary healthcare to the hospitals. Entrepreneurial thinking would be like expansion of telehealth, AI triage, and potential affordable for AI for small clinics will definitely help a lot. So I would take a stand that AI should be expanded in the primary care to the hospitals. It benefits the outreach towards the risk and must implement safeguards for fairness and ethics. So these are the few references which I studied, and I have given the links also for the same. Thank you everyone. Have a good one.